All right, thank you for joining us today for Rescue Medications and Seizure Action Plans in School. I'd like to first of all thank Norellis for sponsoring this session with us this evening. They've been a great supporter of our programs here at the Epilepsy Foundation. My name is Tom Buckley. I'm the Senior Director of Health Information Services at the Epilepsy Foundation, and I'm going to be the moderator this evening for our session. We have a wonderful presenter this evening, Mary Naswa. Excuse me if I pronounce that wrong. She's with the Board of Directors of the National Association of School Nurses and a member of our professional advisory board here at the Epilepsy Foundation. Mary holds a master's degree in health sciences and a bachelor's degree in nursing from Towson University. She's a nationally certified school nurse with 17 years administrative experience in nursing, coordinating, supervision, health services. She works with the Hartford County Public Schools, where she participates in hiring new employees, training and evaluating school nurses, planning strategic growth of health services, and a lot of other great projects. She has been a school nurse in elementary and high schools and has a clinical experience in pediatric neurology, orthopedics, developmental disabilities, and rehabilitation. She has served as a president of the Maryland Association of School Nurses and serves on the board of directors for the National Association of School Nurses. And she is a member of the Professional Advisory Board for the Epilepsy Foundation, and I know she serves on the Committee for the Public Health and Education side. And so I'd like to go ahead and turn this over to Mary right now so we can get started. Mary?
Well, thank you so much for that introduction, Tom. I am Mary Nasuda. I am really proud to be a school nurse. Most of my career has been in school nursing, and it is my pleasure to talk with parents. They are my favorite audience, because when we get it right with parents, we get it right with students. And I'm excited tonight to talk about how to improve the success of your students in school through partnerships with your school nurse. So tonight we're going to speak about seizure action plans quite a bit, and a bit about rescue medications as well. Both of them very important to the success of your student. This topic could be hours and hours and hours and hours long, and it will not be all inclusive. There'll be some things that you'll say she forgot to mention. We don't have the time to mention all of it, but what I hope today is to give you a good foundation, sort of how to get started with schools, so that you do improve the success of your children in school and your own feelings of safety sending your kids to school. The discussions will be a little more practical in nature, but I won't be able to give you all the answers that you're looking for, because unfortunately, each state has so many different ways of handling seizure management based on things like Nurse Practice Acts, which we'll talk about in a little bit. But my hope is that we can create this plan so that we can start to develop these strong relationships, collaborative relationships that help everyone to get off on the right foot. So establishing that from the very start is really imperative. When you think about, it's a little odd right now to talk in the middle of the school year about starting good relationships, but it's never too late to start those good relationships. And this may give you some ideas too about how you want to approach next school year, which will be here before we know it. Laying that foundation at the very start, as soon as you enroll your child to school and at every encounter, will be really helpful to you and your student and the school. Many times what I found are the problems that are encountered in working with schools sometimes kind of go back to those early meetings where someone said something that might have been inaccurate or maybe a bit inelegant, but we sort of start off on the wrong foot, and it takes a bit longer to get back on that right foot again. When I think about the current state of education and healthcare, we're seeing high turnover rates. So you may be dealing with staff that are really brand new administrators, brand new school nurses, teachers, and counselors. And so sometimes we do need to give them a bit of grace as they learn their craft and as we help to advocate for students with epilepsy. So I urge you to equip yourself right from the start with a very positive, problem-solving, collaborative sort of approach so that you can really feel engaged and a part of that school team. You're an important part of the team. I sometimes get pulled down rabbit holes on social media posts, and I'm sure you all do too. Because one of the things about social media posts are they tend to have a pretty negative bias. People don't generally write a social media post that says, everything's terrific with my school. They're so amenable. Instead, you sort of hear what's not going right. And you might get a bit discouraged that, oh my gosh, there are just obstacles everywhere for me taking care of my child. But that is truly not the case. I think I want to start with these two ground rules. Number one, school employees want to help. No one goes into school administration or counseling or especially school nursing because of the huge pay. We really want to help you. We want to help your child to succeed in school. The other ground rule for me, and it's for school nurses and school employees to know, is that parents what's best for their child. So if we start out with those really simplistic sort of rules, it can help to shape our relationship and how we're going to deal with each other. We want to know everything we can about your student, and the way that we do that is through you. Your experience matters so much to creating the right plan for your students. Next slide. So we're going to talk about parent and guardian responsibilities first. We all have responsibilities, but I thought we'd start here on that getting off on the right foot. The first thing we need to know is how to reach you. Now, I was telling you, this is practical advice. School nurses have never had so many phone numbers to call and so few people answering, or voicemail that's not set up. So if you change your phone number, please let us know and give us the number that you're most likely to answer, because getting in touch with you is so important. We want to keep those lines of communication open. We also need to know complete and accurate information about your child's medical condition. We'll talk about this more when we talk about the seizure action plan, but we need to know the type of seizure, how long, when was the last seizure, all of that important information so that we can create this individualized plan. You are the expert. We want to know from you. And of course, we'll need supplies. I always put this here because I think it's a good habit to start, which is to consider using a medical identification bracelet identifying the health condition. This sort of lasts for a lifetime. If kids can get used to wearing them at young ages, it becomes just a part of what they do, and it helps them to start on their road to self-advocacy. Next page. Collaborating with the school personnel staff to create a seizure action plan is really one of the first things that you'll do. That seizure action plan will be changed as necessary. And we're also going to be creating an individualized healthcare plan. I want to take a minute here to describe the difference between the two, because it's often misunderstood. And in a little while, we'll talk about 504 plans, complicated even more. But when we talk about seizure action plans, these are the plans that we're going to be working with you, and we're going to be working with your healthcare provider, and we're going to be working with a school nurse to create a plan that tells everybody what to do when. These seizure action plans are distributed widely through the school to anyone who's working with your child, and they're written in layperson's language. They really help us to define what to do when. Now, the individualized healthcare plan, completely different plan. This is a plan that is made by nurses for nurses. And so it defines the nursing care that we're going to be doing. And that we'll talk a little bit more about that in a moment. But sometimes people will say, as long as you have an individualized healthcare plan, you don't need a 504 or you don't need a SAP. That's not true. This is a very different plan. And it's a plan that nurses write with full of jargon, not in layperson's language. So when we talk about collaborating with them, again, this is all about you providing us with all the information that you have, clinic notes, orders, all of the things that will help us to define the best way to take care of your child. And of course, you're going to also be providing us with the stuff, right? You're going to be providing us with the medication. It's going to be in the label from the pharmacy, not in a Ziploc bag or anything like that. And it's going to have complete healthcare provider orders. Just like if we were giving medication in the hospital, we need to know the dose. We need to know the time. We need to know the parameters, when to give it, the frequency. All of that has to be written out. And almost all schools have their own medication administration form. Try to use that if you can, because that already has everything on it. Now, your physician may, write it on a prescription pad. We can kind of work with some of that sometimes, but really using that form will make sure that you don't get asked, well, it doesn't say here, whatever. And so use those forms when you can. You're also going to be, of course, collaborating with the school nurse about these really important, what do we do for before and after school events. Any school-sponsored activity or event your child is eligible to belong to. And so we need to know about that ahead of time. You know, it's not a very reasonable accommodation to learn on the morning of that they're staying for a club after school. So as soon as you know, make sure the school nurse knows, because she wants to make sure that the supervising staff there are well trained, that they've had seizure first aid, and if permitted, can give rescue medications. We're going to need to make a plan. And so as soon as you know, let us know. The school nurse is sort of sometimes separated from the building. Their office is sort of off the beaten path sometimes. And sometimes they are so busy during the school day, they really don't get out very often. And so it's important that you reach out to them to let them know. They may not know these clubs have even started. And so it's important that you're the one who lets that nurse know in amount of time that she can make that plan. I also have another practical kind of tip, and that is a change of clothes if needed. If your child experiences incontinence during a seizure, after a seizure, they absolutely would much prefer to wear their own clothes than the clothes that are in our health suites. So please think about that for your school day as well. Next slide. So it's unusual to think this, but students actually have a role here too. And that role evolves as they mature, as they get older, and they can participate more in their care if they're able to developmentally. And that participation really starts with things that are pretty simple, things like avoiding triggers if they have triggers. That really helps a child to start to develop, again, those self-advocacy skills that are so important for transitioning between schools and into adulthood. For kids, and this can be hard, informing school staff immediately if they're having symptoms or aura, or if they've had a seizure that perhaps someone didn't notice. This is hard. There's still stigma about seizures. I don't understand why, but we want to get that stigma gone with our kids. We want them to self-advocate and be able to say these. And it can be hard. Your kids can be shy sometimes or not want to bring attention to themselves. But this is a really important self-advocacy skill that we can build and normalize, and really reward kids and really let them know how important it is and how grateful you are that they've understood the message and that they are taking care of themselves as well. Now, the development of the seizure action plan itself can be something that kids, as they mature and grow, if developmentally able, can participate in, and talk about a huge self-advocacy leap when children can be in those meetings and say, this is what I want to happen. And so this always warms our heart when we can get to that point with kids who are participating more in their care and more in that care plan for those before and after school events. There may be times with particular circumstances in different states where kids can even self-carry and self-administer if permitted. So students have a role too, and it's a role that often gets overlooked. But gosh, when we can start it early on with kids with those self-advocacy skills, what a difference it will make for them as they transition into adulthood. Next slide. Well, the school nurses, of course, have very broad and comprehensive role here. And that role is the team leader. Sometimes we'll hear about, well, school nurses can't be everywhere, and that is certainly true. But as the school leader, they're going to be telling and helping to ensure that there's a safe plan for your child. And it all starts with assessment. Those of you who may be nurses on the call or know nurses know that we follow a process, and that process always starts with assessment. That assessment is going to have a lot to do with the information that you provide to us. We are the writers, the creators of that individualized healthcare plan. We talked about this document earlier as a document that's written by nurses, and it's for nurses. And when we say it's for nurses, it's full of nursing jargon. And certainly you can view it, but you'll see that there are nursing diagnoses there, like potential for safety concerns. And then there's a plan for how we're going to make sure that we do everything we can to keep your child safe. It helps us to anticipate problems. And so if you look at individualized healthcare plan templates, you might see that there are just a huge amounts of these nursing diagnoses, but they may not apply to your child. Your child may not need all of those accommodations or diagnoses. and plans to be made. I will say that this particular form is one of the most misunderstood. People seem to think this healthcare plan is something that everyone looks at, that you distribute around. It is not, but it's such an important plan because it talks about those skilled nursing activities that are important to keep your child safe. Now, the seizure action plan, which we've talked about, we're going to talk about a little bit more, in some cases could be called an emergency action plan. And in some districts, they may have a plan that looks similar to the Epilepsy Foundation one. And we'll talk about that one specifically in a moment. But just make sure it has the same information and that it is being widely distributed, that anybody that works with your child knows what to do in the event of a seizure. I've heard families say that they would love to have a private duty nurse, even though it's not necessarily indicated. There are no skilled nursing activities. But the one thing that we can't do, even as nurses, is stop a seizure, other than maybe using a rescue medication, which we'll talk about. That's why it's important that this is a widely held a body of knowledge for everyone in that community to do seizure first aid. And seizure first aid classes are available on the Epilepsy Foundation's website, and they're awesome. And school nurses are very skilled in doing that education as well. That staff education is really where school nurses can shine, and that's the next part of our responsibility. Because we can't be everywhere, we can train staff to respond. And as a leader of that team, our influence and our ability to help is really multiplied by how many people we can teach to do this skill. I think it's easy to say, what do I need a school nurse for? Because everybody knows how to do this. We need to have that school nurse to do that education, right? And to make sure it's done with fidelity. As we've seen, and we'll talk about Seizure Safe Schools Act in a few minutes, there are some great things that are happening to ensure that the community at large is able to respond. But you need a leader. And that leader is the school nurse, the person who can do that education, who has the skill set to do that education. We also evaluate all of our plans often. We evaluate our plans in my district, we do it quarterly, but we evaluate the plans and we decide, does this serve? Is it doing what it's supposed to do? And should we make adjustments? And this is where you can come in as a team member. You can say, this plan does not work. We need more. And if that's the case, working with your school nurse is the way to go. So let's go to the next slide and talk about specifically seizure action plans. Again, seizure action plans are a team sport. They are not something that someone dictates and everyone just follows. We need all that information. We need it from your provider, from you, and from the nurse who has some expertise and probably has worked with other kids who have epilepsy and knows a lot about seizure action planning. There are lots of plans that are available on the Epilepsy Foundation website and lots of other websites. But all of them should have a lot of the same information. One of the things I'm so glad about with seizure action plans, and what's changed in my career, which has been pretty long, is that seizure action plans are now thought as a standard of care for all people with epilepsy. And that's just terrific, because watching a seizure, I remember as a brand new nurse, the first time I saw a seizure, it's scary. And it can be scary, especially for lay people who have not seen seizures. So having a plan far ahead of time that tells you, if this, do that, and practicing that plan really can help when the emergency arises or when a seizure arises, whether it is an emergency or not, because it gives us some familiarity and sort of a feeling of not being sort of lost. It allows people to act with empathy and understanding rather than fear. So if you haven't really thought about seizure action plans, I urge you to think about how this plan can help to improve the care that your child gets and decrease the fear that the community may have around seizures. I found that when a good seizure action plan is there, and I can go through it with the teacher and say, this is what seizures generally look like, this is how long they last, and this is what you should do, there's a feeling of wanting to be the helper. So seizure action plans, as I say, are becoming a great standard of care and really should follow people well beyond school, because our community needs to know. And that's our people who are employed with, our employers, people we work with. It's really important to not stigmatize this, but to prepare for it. And that's what I just absolutely love about seizure action plans. Next slide. And the one seizure action plan that I really love is the one from the Epilepsy Foundation. And I have it here. If possible, anytime you have a 2-page document, you should try to front and back, not have it as 2 pages, but it needs to be 2 pages. And I'll tell you why. It has some great information on here. And this form, not only can it be downloaded, but it's also fillable on that site. And that makes it even nicer because it's easier to read than if someone's filling it out by hand. So the first part of that seizure action plan is just that demographic information, right? The name, the address, the emergency contacts, the birth date, and some phone numbers. And again, all seizure action plans should have this because this is sort of our basis of how do we get in touch with you. The next part is nice and boxed in, and it's the seizure information. It gives you the type, how long it lasts, how often they occur, and what happens. And again, this language is meant to be layperson language. This is not meant to put in a whole bunch of medical jargon that people can't understand or medical abbreviations. This is what anybody should be able to pick up and say, oh, that's what happens. This allows you to put different seizure types. If your child has more than one seizure type, it does have 4 boxes here. And I think this is a great way to, again, right from the start, if. This is the if right here. The next part is the then, and that's how to respond to a seizure. And these are nice check boxes. So this is a very easy form to fill out. It shouldn't take a very long time. But here we have our first aid, which all of you know the Stay Safe side. And if you don't, please take that seizure first aid training, because it is so nice to have something that's so easy to remember and say and know. Giving rescue therapies, notifying the contacts, and calling 911 right there on how to respond. So that's the if then. But what's nice about this form is it goes on a little further. It tells you the first aid for any seizure. It kind of goes through what does Stay Safe side mean. And that's great. And it also talks about a VNS if your child has a mixed nerve stimulator. And then the red box is the box that I know a lot of parents really appreciate. It's when to call 911, not call 911. When to call 911, because 911 may not be appropriate for every seizure. And this will tell you the boxes of when you should call 911. It also tells you when to call that provider. What's nice on this form too is that it gives you plenty of room for rescue therapies, which we'll talk about in a minute. It gives you actually 3 different medications or treatments that you can put into this form. Now, all of that information is your if-thens, but the after is so important as well. And so the back page, and this is a spot that often gets missed in seizure action planning, is the care after the seizure. What can we do to help? Seizures may be very short, but the postictal or after seizure phase may be longer for your child. How do they act? What can we do to help? For some children, it is to sleep, but this allows us to individualize what's best for your child after a seizure. We also have those special instructions for first responders here and for the emergency department. If your child has a rare epilepsy, there may be something that's a bit different here in your special instructions, and this gives you a nice big 2 lines, plenty of space to at least give you an idea of what should happen next. The next part is daily seizure medication. Many people wonder why we need this. Well, it's really important, especially if a child is having a problem, to be able to know what they generally take. And we'll talk about this for school nursing in a little bit. The other information lets us talk about triggers and history and surgery and devices and even diet. And lastly, the healthcare contacts, who the epilepsy provider is and how we can get in touch with them. So this is sort of the gold standard of seizure action plans. It's one that's widely and easily accessible for you. It's easy for laypersons to read. I think most laypersons feel like, yeah, I got that. That's something I can figure out. And it's, like I say, very accessible. All right, next slide. So the plan itself has to be a living document. It cannot be something that's static, that we make it when they're in kindergarten and hope it lasts till they're a senior. That just doesn't work. These plans have to be changed to meet changing needs. When you have changes to medication, even if they're daily medication, the school nurse needs to know. People say, well, they're not giving the medicine. Why do they need to know? Well, changes in medication may have changes in seizure patterns or frequencies. We need to know that so we can watch out for it. We can also be your helpers in looking for side effects that might occur because of seizures that a seizure medication that a child's taking. We want to be your partner here, so please cue us in, and we'll cue you in when we see things too that have changed during the day. I urge you, though, to talk to the school nurse and not the teacher. Sometimes, most times, you're going to be talking to a teacher way more than you're going to be talking to your school nurse. And the teachers can be terrific at taking down some messages, but they're not medically oriented. So they sometimes get the message a little wrong, or if you want to ask a question, well, tell me why. Why did the medication change? And in those cases, we really do want to talk directly to you and have a conversation back and forth. So although we might be sometimes hard to reach because we've got all kinds of kids waiting in our waiting rooms, we want to talk with you. So if there are changes, please let us know. We want to look at these at least yearly, but quite honestly, it's whenever necessary. So whenever there's a change in that form, and you'll have a copy of the form too, you want to let us know about it. We can do it at any time during the school year, and we want to do that to make sure that we're really meeting the needs as they exist right then. Next slide. The next slide comes with a huge caveat. I am not a legal expert, but these are 3 laws that I know that all the people on this phone call have some understanding of. The ADA, which protects people with disabilities from discrimination, and then the 2 that are a little more specific to education, Section 504 of the Rehabilitation Act, and the Individuals with Disability Act, or IDEA. It looks like we went backwards, Tom. Can we go forward? Good. And then the next slide. So we're going to talk about both laws, but again, caveat, not a legal expert, and there are legal resources through the Epilepsy Foundation to help you to understand these laws more carefully and how they may impact your child's education. I want to talk about, even though this slide says Section 504 in the Rehabilitation Act, I'm going to talk a little bit about the difference between the 2, just so it's a little more clear, because even people in education can sort of get this a little messed up. So in a Section 504 plan, there are children with disabilities who don't require special ed. So there's no special education services, but what we're doing is making sure that we can provide reasonable accommodations so that the kids can participate. It's an access law. IDEA, however, is about the IEP. These are children who are accessing special education. So the laws are quite different, even though they sound a bit the same. There are a lot of 504 plans that you can find ready-made for you on the internet. And they're sort of like those individualized healthcare plans, right? They give you every possible thing that a child with epilepsy might need, but they may not really reflect what your child needs. And so know that they are just plans that are helpful in thinking about and making a template. I've had people tell me that they've used AI to create a 504, and I'm sure it does a lovely job, but it doesn't know your child like you do. And so we need to look at those plans sort of with a grain of salt. That doesn't mean we need all of those accommodations. Many parents will ask me, does my child with epilepsy need a 504? And I always respond, that's the decision of a 504 team. So 504 teams are in all schools, and you're a part of that team. And together you can work to determine if this is appropriate for your child. But the team decides if you need the 504 plan, not the internet. And the team will actually look at whether your child has a physical or mental impairment. And the words that they use are substantially limits a major life activity, of which there are many. And they'll write accommodations based on that information. So it's not an automatic, I have a diagnosis, I'm going to get a 504, but your advocacy and meeting with that team and explaining sort of who your child is as a learner can be really important in that determination. Now, the next slide is IDEA. And those of you who have an IEP for your child know about special education. Your input in the IEP process is usually important as well. You talking about the present levels of performance is so valued in creating this plan. I also want to really encourage you to get to know your special education case manager. I think sometimes those meetings are quite intimidating. I try to sit with parents when I am in an IEP because I feel very much like people are talking sort of with lots of acronyms. Stop people when they use acronyms you don't understand. Stop people when they use jargon you don't understand. It's important that you're a part of this and that you understand your child's plan at school. I also think that, when we talk about IDEA, it's important to remember that, again, that same rule that we talked about at the beginning, people want your child to succeed. Those changes in the curriculum and making progress toward them are so important to your child and really getting the benefit of school. So know your team, be a part of that team. And if you're not understanding something, stop the conversation. Sometimes I'll see people who are just doing a lot of nodding and I'm not sure they're getting it. And it's important. You're going to sign that form. If you don't understand, please stop them. You'll often find that kids with epilepsy may be served through an IEP as other health impaired, which you'll see when you go to those meetings. All right, next slide. So here we're going to kind of transition over to rescue medications. And when Tom and I first started talking about this, I was like, this is such a hot trend and one that we're still trying to get our hands around in school health. I want to say that even though the plans are going to vary, we're going to still abide by the ADA Section 504 IDEA. And one of the problems that I've seen with rescue medications in general and the worries for families are, first, who can give it? And is it accessible? And is it available? So you'll hear the word delegation a lot when we talk about who can give the medication. And one of the things about delegation is that it's not someone's opinion whether something can be delegated. It's generally dictated by nurse practice acts. And there are nurse practice acts that are different in every state of the union. And that's what makes this really tricky to talk about in a national way, because it will vary state by state. Those nurse practice acts, because they vary, mean that you're going to be working with your school nurse to find out, is this something that can be delegated to another person? And we'll talk a little bit more about that in a moment. But the plan has to be developed to make sure that the kids with disabilities are protected, just as our laws require. One of the biggest problems is that when the Nurse Practice Act itself is really about defining the scope and standards for nurses. What can they do? And most of those nurse practice acts will have something to do with delegation. Who else can do this? And the nurse directing that delegation is a big part of this, and I'll talk about that in just a moment. Unfortunately, and this is a huge unfortunately, is that there are not school nurses full-time in every school. And I know that, and it makes me very sad. 65.7% of schools in the United States have a full-time nurse. Now, the American Academy of Pediatrics has recommended that there's a nurse in every elementary and secondary school. But I think it's 6% of schools have no access to a school nurse. Now, I've already said that the school nurse is sort of the leader of that team. She ensures that things are done with fidelity. But if she's not there, certainly becomes a real problem, especially when we start talking about things like rescue medications and the Nurse Practice Acts. It is something that if you have the ability to advocate, and I know you guys do a lot of advocacy with the Epilepsy Foundation, advocating for a nurse in every school. There are 2 or 3 federal laws right now coming up about having a nurse in every school. It is a great return on investment. We can show you the data about that. But it's really important that you have somebody who leads this team, because as we start to see more legislative acts come through, having someone who's sort of skilled and knows that they're going to be responsible for this makes it much more likely that you're going to be following it again with fidelity. So you're going to need to work with your school nurses in whatever state you are to find out sort of how this plan is going to evolve in your case. Next slide. So when we think about delegation, which is not only the school nurse can give, but someone else can give a rescue medication, an emergency medication, we look at a couple things. One is, of course, is the Nurse Practice Act. In my state, in Maryland, we are permitted to delegate some emergency medications. That means, and we'll talk a little bit about permitted, and just because it's permitted, do we do it kind of thing. But we're also thinking about school district policy. In some states, there are district policies that may affect that safe delegation. But even when we're allowed or permitted to delegate, it's the registered nurse who is the one deciding if this is a safe delegable activity. So we do this based on our knowledge, our skill, and judgment as registered nurses. And what we're looking for is we're looking for things that are chronic and stable and predictable and routine, not something that you have to do an assessment about, something that a layperson could easily do, if this, then this, like our seizure action plan talks about. And what we're also looking at is the environment conducive to having this skill. A teacher who's taking care of 30 students and is in a zoo field trip, maybe not the person who could be safely delegated a medication. And so we're looking at also the person themselves. You know, we're talking about unlicensed people. We want to look at that person. Do we think that that person is competent and can do that task safely? That is going to be an important part. Now, if we decide that, I know when we decide that delegation is impossible, that means we got to think of another plan. Sometimes that means sending a nurse on a field trip. In Maryland, we don't allow we don't delegate the calculation of dosage. So oftentimes with our students with diabetes, we may send a nurse. It's going to vary depending on where you are and sort of what your policies are in your state and in your district. But we're looking at all of those things, that right drug, the right dose, the right route, the right setting, the right person, because we want to keep your child safe. This is all about safety. So even when things sort of are allowed to be delegated, we have to look at, is it safe to be delegated? And so that's another kind of complicating factor as we kind of get this new horizon here with so many rescue medications that we're starting to see. The good news is our rescue medications routes are more varied. We're able to use intranasal in many cases instead of just the rectal medication that we've had previously. That obviously opens up all kinds of great accessibility and ease of administration. We as school nurses are super excited about the intranasal medications, how effective they are. Now, when we're talking also about all these legislations and all these laws, one of the things that is really on the horizon and has been very successful in many states is the Seizure Safe Schools Act. That may provide some more clarity about delegation in different states. Next slide. All right, we're going to talk about the Seizure Safe Schools Act in a minute. Before I do, though, I want to just touch on this idea of storage and accessibility. All medications have storage requirements. And so it's important that we follow the manufacturer's guidance about where medications can be stored. And this often happens when people say, can I just keep it on the bus? Well, the buses get really hot and they get really cold. And obviously that's just not a good, safe place to keep them. So we do have to think about how we store them. And then we think about accessibility. And when I think about accessibility, I think I want it to be at the ready when I need it. But I also want to make sure that it is kept away from other children who certainly wouldn't want anyone else to take this medication. That would be dangerous. And from diversion, because some of these medications, these are controlled substances, could easily be diverted. So you can see sort of what we're up against in the world of school health. I was telling Tom, this sort of reminds me of the early days of epinephrine and naloxone, where we were like, we're going to have epinephrine everywhere. We're going to have naloxone everywhere. And it took a while, and it's actually still sort of filtering into many states. I'm lucky to be in a state that's a bit more progressive that way. But I just want to let you know that, again, these plans are going to vary. They're not always going to look the same. Just like we're making individualized plan for your child, there's not a cookie cutter approach to how we manage rescue medications in schools. We manage them though, and that's the important thing. It may be that your state's not as progressive, and it's going to take a little while, and we appreciate your patience as we as healthcare professionals sort of manage and figure out solutions that are safe and effective for your child. But 23 states now have enacted seizure safe schools legislation. And what I love about this is that it mandates school personnel to do the seizure recognition and first aid training. This is huge. This is huge not just for schools, but I can tell you that I've responded almost as often in the community to folks who are having seizures, and that seizure safe training is so important. Sort of like our CPR, where we sort of like, we know what we're going to do, and we sort of are we just go right to stay safe side. When we talk about seizure first aid, the more we can practice this, the more we can teach this, the better. And having your school nurse be the leader of that team to ensure that we have good training is so important and just so helpful to the entire community. They also require that students with epilepsy have a seizure action plan on file. And yay, again, a good standard of care that we should all people with epilepsy should have a seizure action plan. And some of them, and it's very state by state, have a requirement for the administration of FDA approved treatments in the school setting. Now, we're fortunate in Maryland that our Seizure Safe Schools Act also says that there has to be someone else other than the school nurse who can administer the seizure rescue medications. And we can do that because our Nurse Practice Act allows for some of that. It helps us to delineate that, we have another person besides the school nurse who can do that, especially in places where there may be a part-time school nurse, or if there may be after-school activities where the school nurse is not staying. Though kids think we live at the school, we do not live at the school. And so we do go home at night, and, kids who are staying after really do need the ability to be sure that they're being cared for. So I'm excited about the Seizure Safe Schools Act. It does present some challenges for us, but it's challenges that I don't think are insurmountable. It's just, it may take us some time. And again, appreciating your patience. Next slide. The next slide is next steps. And we're going to end just like we started, which is continuing to work with your school to seek solutions that fit in your state and your school district parameters. Working with schools can be challenging at times, but I want to remind everyone again of our top two thoughts about relationships. We know you want what's best for your kids, and we do too. And so again, that is the important sort of ground rules for us to remember. Keeping your school nurse updated about any changes in your child's care is always important. We want to partner with you. We want to address your needs, and we want your child to be successful in school. So thanks for your patience with as we work through these new challenges. And I think that ends it for me, Tom. Do we have any questions tonight?
We do have a couple questions in here. And one of them I wanted to, I was kind of holding on to through your presentation to see if we got around to it. And this was shared with us by Jacqueline, is that they had a seizure action plan, but they don't always feel confident that everyone will properly follow it. Do you have any advice on that?
I have some good advice on this one.
Yeah.
First of all, I hope you have a school nurse because I think that discussion starting right there with the school nurse about why don't you think that is happening is important. I like to think about planning, especially planning for any emergency, as having some drills. And so many schools have sort of these early dismissal days. Those are the days that I do a lot of drill and skill. So we pretend to have an emergency, or we pretend to have a child in a classroom having a seizure, and we practice it. The other thing is that I believe that these plans need to be reviewed more than one time a year. At the beginning of the school year, you can imagine that teachers are super, super busy. They're trying to get their classrooms ready. They're trying to meet parents, and they're trying to create their lesson plans. And so for us, we try to do them. We often talk about our quarterly trainings rather than our annual trainings. And our quarterly trainings, we've done our annual training and then we revisit. And so it's something you may want to suggest to the school nurse that's working with your student is that at report card times, and that's how we know quarterly, you get 4 report cards a year. Quarterly, we're getting ready to do in February, our next one. We just go by and we say, hey, I want to review the plan with you again. No one can remember something for a year when they're so distracted with other things that are going on in the school building. So I do suggest, the idea of having a drill for your staff and suggesting that to your school staff. And then the other being that it's not just a one-time thing. That's really important, I think. And the other thing that I've been doing more of lately is debriefing. So once we've had an event, is to talk about how well it went or how well it didn't go. What did we forget to do? What could we have done better? What did we not anticipate? And so that debrief also brings everybody back to that seizure action plan again. I find that when I approach it like education, this isn't sort of punitive. I just want everyone to know what to do and to review it again. I find that people are generally very grateful that they didn't have to remember everything, that they have another opportunity to ask questions.
Great. And so this one also, and another person brought up, besides advocating for a school nurse, because we know that could take some time, what do you do if your school does not have a nurse at all? And what are some things that we can do what are some tips that we have?
Right. So I do want to again, plug for the advocacy for a school nurse, because sometimes we think that's an insurmountable problem, but what we find is that it's not nearly as difficult as we think. It's one person in a building, we're not asking for a lot of people. And the return on investment is so high, you can look on the National Association of School Nurses to see that. But regardless of whether they have a school nurse or not, they're going to have someone who is directing that care. And so what you'll see in some school districts are sort of cluster programs where one nurse will go to many schools. She's still in charge of that plan and still a person that you would want to get in touch with. When there is no nurse, that 6% or so of the schools in the United States that don't have a nurse, they have to have some consultant or someone who can help them through that. Sometimes what we have in our state, we have something called delegating nurses. Where there are no nurses, where a delegating nurse is not only delegating to whoever's going to be giving medications, et cetera, but also delegating, making sure that that staff education is done. So if you don't have a school nurse in your district, there's someone who is responsible for that. And that advocacy for school nursing, again, I just don't, it's hard for me to imagine how kids, how we can really optimize health if you don't have a leader of the team. Now that team might be bigger than we want it to be, but there should be someone there who is leading that team and hopefully can help you advocate for that staff.
Great. Had another one come in. And what are your thoughts or experiences with wearable devices that alert the nurse when a seizure is happening?
I think that this is an evolving technology. I can say that early on, we didn't have very much success with them. They're getting better. It reminds me again, like when I think about sort of trends in school health, when we first started with diabetes continuous glucose monitors, they were not very good. We couldn't rely on them very much. Now they're amazing. I'm hoping that one day we're going to get a device that has that reliability and validity. I haven't seen it yet, but that may just be my experience. I'm going to keep watching for them though. I always love the idea of anything we can do to decrease the sort of suddenness and scariness. And I'm hoping we'll get there. Technology is going so quickly. I'm excited about the possibility. Obviously, I know parents are too, for safety.
Great. And then I know we discussed this one earlier about what do I do if the school won't let my child participate in an activity because of their rescue medication and the inability to keep it safe?
Yeah, this has been, again, an evolving issue because we're seeing so many more rescue medications. I would urge you to get the support from the Epilepsy Foundation. your child being able to participate is so important, and we want kids to get everything they can out of school. This might be something that is going to take some real creative problem solving at the school level. And I would urge you to sort of have an open mind as you go in, because sometimes when someone has said no, they may have not really understood the ramifications of what they've said. And so revisiting it in a calm manner and getting that advocacy is really important. And I'm hoping that this isn't happening frequently. I know that we've also talked, Tom, about field trips and the like, and we can figure these out. The solutions are really not that difficult. I would say that the nursing shortage has really caused us some consternation in my state, I'm sure nationally. And so that's also another issue that you may have with these plans if a nurse needs to be there. But I think, again, we're going to start to see the tide turn, and we're going to start to see that people understand that these medications are safe. But we do need a plan. We can't just, of course, have them sitting on a child's desk, obviously. And so we're working on throughout the country on how to make a safe plan. And like I say, I wish I could say this is the solution and everybody do this and it'll be fine. But again, variance in state law and Nurse Practice Act, and sort of each school's ability, district policy, all of that's going to change things. But I would reach out. I will say the Epilepsy Foundation are probably one of the most responsive of all the advocacy groups to help us to get what we need for our students with epilepsy. And what I love about working with the Epilepsy Foundation is that they truly are team members. They don't come in guns a-blazing. They know that we're working together. And I really appreciate that. And I think that all of us using that same approach of kindness and understanding really will help to drive our programs forward and to make sure we're meeting everyone's needs.
Well, thank you, Mary. I have no more questions in the queue. I did want to take an opportunity to share some information with the participants and to remind everybody that we do offer a free seizure first aid course on epilepsy.com first aid. We do offer our course now in both English and Spanish. We have an instructor-led course. There's a certification course that's good for 2 years, where you can take an on-demand course. We also have our first aid poster and available in over 14 different languages available as well. And again, you can get to that at epilepsy.com/first aid, and that'll take you both to the English and the Spanish site available. We do offer support groups. They are virtual right now. You can visit epilepsy.com/support groups. They're available out to adults, teens, youth, caregivers, parents. All of them are available out there. And if you need other support or you're looking for other services, please reach out to our Epilepsy and Seizures helpline. We're available 24 hours a day, 7 days a week, weekends, holidays, Christmas, New Year's, we're there. We can provide other information on treatment, help guide you towards answers to medical questions, emotional support, even the legal advice. We can get you connected to some direct information, or if you do need that advocacy or you're having challenges with the school and you need to speak with the legal team, we can get you connected up with that service and get that taken there. So other than that, I would like to thank everybody for joining us this evening. This recording will be made available in a short period on our YouTube playlist at a later date. And again, thank you everybody for joining us and have a wonderful evening.
Thanks, everybody.